we know that the United States has developed a very major system for training subspecialists in cardiovascular medicine. Professor Maron, could you tell us how subspecialty physicians in cardiomyopathy and heart failure are systematically trained in United States? And on a personal level, as an HCM specialist yourself, what has given you a greatest sense of achievement during your career?
Answering the first question, in the United States, you have a training period for general cardiology, what we call a fellowship, that usually lasts a couple of years, and then you can do more training specifically in heart failure. But what we don't have, and what I think we need to have now going forward here soon, is specific training program for cardiomyopathy. And it's time for that now, for sure. Yeah, it's time for that. And I think we're starting to recognize that in the United States. I think we're recognizing it in other parts of the world as well. And I hope that that will change soon, that we're going to have specific training programs for cardiomyopathy so that we can train the next generation the right way here. And so that's what I think everybody's hope here. And I think we will see that soon. I think in terms of my greatest sense of achievement, during my career, I think I'd probably say two things. Number one is, to this day, get a lot of enormous satisfaction with how well we can provide therapy for our patients today. And that nothing gets me more excited than being able to see the benefit of treatment in improving the quality of life of our patients. And, it's a kind of a disease where these treatments are so good that it's such a satisfactory situation when you see them come back and they tell you how much better that they are because of what you were able to provide them in terms of treatment. I think that is, there really isn't anything better than that. And I'll also say on top of that too, is that even for those patients that we don't necessarily have to treat, just educating them about their disease to provide a sense of empowerment and comfort so that they can understand their situation through our kind of expertise that we can provide to those patients in clinic, really, it also provides another incredibly satisfactory aspect and achievement, I think, as well. And so it's those really two things that I still find, to me at least, are really exciting. They still motivate me. They still get me very excited to go in and see patients every day.
CMI has studied a precise therapy area for HCM. How will HCM care evolve? What do you think? Maybe the next breakthrough follow CMI?
Well, it'd be great to hear everybody's thoughts on this because it's such a great question and it's a great one to certainly end on. Here's what I would probably say. And I certainly could be wrong here, but I think the next sort of phase here is providing therapy earlier in the natural history for patients to potentially provide even more benefit down the road for those patients than we currently do it. Okay. And so that may mean, for example, more upfront use, for example, of myosin inhibitor therapy to relieve obstruction, okay, in patients that may be not quite as symptomatic as the ones that are being treated today. So more earlier intervention with the kinds of emerging therapies that we have is one big concept that I think we're going to see more about as we move forward. And the second is, I think we're going to see continued breakthroughs in other drugs that provide additional mechanisms of action that provide benefit to both potentially obstructive and non-obstructive patients to continue, I should say, further improve efficacy, safety, and ease of use so that we may end up, not that far off in the distance with a multi-drug approach to patients with both obstructive and non-obstructive ACM to provide most optimal outcome.
Yes. I know there is a drug is in trial right now. It's
Sure.
conducted by you. It's
Yeah.
about the mitochondrial
Right,
energetic,
mitochondrial energetics. That's right. That's
yeah.
right. So drugs like that are addressing other potential disease pathways that could provide benefit, hopefully we'll be able to show that, but they can be used in conjunction with other drugs to really provide even more optimal improvement.
东方问道。